everyone, and I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty. Today we will be studying about the aneurysm, and one short note will come from this topic. Trust me guys, CVS is so important topic that you can't skip, right? An aneurysm short note will come in your exams, right? So aneurysm is basically the ballooning artery story. We have read about the heartbreak also, right? The love story. Now it's time for us to know about the ballooning artery story. If you remember by this now, it will be very useful for you at the end to remember that what the things stands for, right? Without wasting any of your time, why I told you this, that it is a ballooning artery story? Because what happens now, there is a blood vessel and there is a protrusion. There is a ballooning like projection that will occur. We will read about that in detail. So aneurysm is basically a localized abnormal dilation of the blood vessel. See this dilation I have told you. It is basically a dilation of the blood vessels. It is due to the weakening of the vessels. Obviously, if you have read about hernia now, then what happens in the hernia? In hernia, when the muscles are weak, then the person is most likely to develop hernia, right? It can lead to rupture, which is a life-threatening condition. Sometimes it can also lead to the rupture, and we will read this in our CNS chapter about the very aneurysms. They are very important. Okay, so what are the classifications? See, classification are basically based on the morphology. In the morphology, you have the true aneurysm and you have the false aneurysm. What is true? See, true people are the people who does not backwitch about you, who does not say anything negative about you behind your back also. Okay, are the true people. So true aneurysms, they involve all the three layers. Okay, example is the fusiform aneurysm. I'll show you the figure, and the saccular aneurysm. False people, they will be very sweet in front of you, but behind your back they will destroy your image, right? So they are basically the false aneurysms. They disrupt the vessel wall with blood contained by the surrounding tissues. Okay, let me just show you the figure. So you have this is your saccular one, the one that I have drawn above. Then the fusiform. I think you have drawn this same diagram in your 11th or 12th standard in your botany, right? So I hope so you are able to relate with this structure. This is a fusiform structure. Then you have the dissecting one and the false aneurysm. Okay. Now, what happens next is, next we will be talking about the etiology. What are the causes of aneurysm you have? First one is the atherosclerosis. First one is the atherosclerosis, and in atherosclerosis what happens is, there is a blood vessels, and in the blood vessels you have a lot of plaque which get accumulated, as a result of which the blood flow will decrease, as a result of which the blood flow decreases and patient does not get enough amount of blood. There is a demand supply mismatch. There is a demand supply mismatch that will happen. Okay. Second one, it can be congenital. Congenital are the conditions which are present since your birth. So these are the berry aneurysm. We will read about berry aneurysm in our CNS chapter thoroughly. Okay. Then you can have the infection like the bacterial infection. Then the inflammatory one like the Takayasu arthritis. And tell me guys, Takayasu arthritis was either a large vessel vasculitis, medium, or the small. So Takayasu along with the giant cell was a large vessel. Okay. Then you have the traumatic, that are the penetrating injury. Obviously, the person is having, like, see, I'll draw. If there is a, like, there's a weapon, it's pointed. Okay. So, and if the person gets stabbed by that penetrated, what you can say, penetrated weapon, what will happen? There will be a lot of trauma to that area, right, which was exposed. Next, so next you have is the either the genetic or the connective tissue disorder which can cause this condition. Let's talk about the location. So location, you have the 4 locations: aortic aneurysm, cerebral aneurysm, peripheral, and the cardiac aneurysm. Okay, aortic, cerebral, peripheral, cardiac. Okay, remember them. Let's talk about the pathogenesis. In the pathogenesis, what happens is there is a weakening of the vessel wall. I have told you the blood vessel, this is your blood vessel. After some time, what happens? Blood vessels get weakened as the age progresses. This is your blood vessel. This was intact. This is your intact blood vessel. This is your weakened blood vessel. After that, what happened is there is a increased wall stress. There is a lot of stress to the wall, and then there will be dilation of the vessels. What are the factors that influences? First one is the hemodynamic stress. Obviously, if there is a lot of blood flow, what will happen? There will be a lot of hemodynamic stress to the blood vessels. Structural defect, if there is elastin fragmentation or collagen deficiency. See, collagen deficiency, I know girls know very well about this collagen supplement. So collagen basically prevents the aging and prevents the sagging of the skin, right? So if there is collagen deficiency, the blood vessels obviously will get sagged, right? Third one is the inflammation. Inflammation is the process by which there is an infiltration of the macrophages and the lymphocyte. Third one, you have a very important law of Laplace. What that means? Wall tension is equals to the pressure into the radius, and you will learn about this in details in your physiology lectures, because the physiology professor will explain you this law very beautifully. Okay, next let me just talk about the histopathology. In the true aneurysm, I have already told you earlier, all the 3 layers are intact. But what happens now when the person is developing aneurysm? The layer will be thinned, okay, but they are intact. Okay, a true person always remains a true person, no matter what the external environment is throwing upon him, right? And a false person always remains a false person. So you have the false aneurysm, in that the blood clots are basically surrounded by the fibrous tissue. The blood vessels get surrounded by the fibrous tissue. Okay. Next, let's talk about the clinical features. See, clinical features, we have the clinical features according to the aneurysm that we are dealing about. First one is the abdominal aortic aneurysm. In the abdominal aortic aneurysm, for a longer period of time, the patient remains asymptomatic. There are no symptoms that the person shows. Second you have is the palpable pulsatile abdominal mass. When you will do the abdominal examination, I'll tell you, since you are in second year, whenever we do the abdominal examination, what are the things that you have to do? First, take the consent of the patient, then properly expose the patient from 𝗲𝗵𝗵 sternum to the 𝗵𝗵𝗵𝗵 symphysis, right? Then what do? You do the abdominal examination. You divide the abdomen into the 9 quadrants, right? Then according to that, you basically palpate the areas, and wherever the person will feel pain, he or she will tell you. And although he or she is not able to tell you or don't want to tell you, you can look at the expressions of that person, right? When I was in second year, I remember that in my medicine posting, there was a patient of appendicitis, and he was not able to admit that he is a patient of appendicitis. So when we did the palpitation part, we were clearly seeing the change in the expressions of that person, okay, because it's obviously painful whenever that person palpate that areas. Next you can have the rupture. When there is a rupture, there will be hypotension or the shock, and you have different type of shocks that we will study later, right? Or we will study in your surgery lectures also, okay? Shock. Next you have is the thoracic aortic aneurysm. In that, see, thoracic, thorax, something related to your chest. So the person will have chest pain. The person will have severe chest pain. Second, the person will have cough, right? And dysphagia, that is the esophageal compression the person will have. Next, cerebral aneurysm. Since we will study this in our CNS chapter, I am just giving you an overview over here. The person is asymptomatic. For a longer period of time, the person is asymptomatic, and you know when the person becomes symptomatic, when the aneurysm has ruptured and you have a subarachnoid hemorrhage. In that, you are having aneurysm and a thunderclap headache. The person will say, I am having the worst headache of my life. No medicine can cure this headache. The person will come to your clinic and say that, doctor, I just can't take this headache. I am having a severe headache. It is the worst headache. The patient will have the worst headache of his or her life, okay? So you should never miss this case. Then the person will have nausea, vomiting and knuckle rigidity. Nausea, vomiting and knuckle rigidity. What are the complications you can have? Either you can have the rupture of the aneurysm. The aneurysm can rupture, and it is the most dangerous condition that can happen. Second is the thrombosis and the emboli formation. Either they can be the formation of thrombosis, thrombi, or the emboli formation. Infection can be there, right? Because the patient body is not able to take that much of pressure, and then in case if the foreign antigens also decides to attack that, then what will happen? There will be infection. And fourth you have is the compression of the adjacent structure. I'll show you with the help of diagram. If this is the blood vessel, you are having an aneurysm over here, and you are having certain adjacent structure to this, then what will happen? The aneurysm will try to the aneurysm will try to push that structure, right? It will try to push that structure. It can either push the nerve artery or the vein. What are the investigations you have to order? First one is the blood vessels. Although it's not that important to order blood vessels, but blood tests are our first line of investigation that you have to do. Imaging, you have to order for the ultrasound, then the CT angiography, X-ray, and the digital subtraction angiography. These are the 4 investigations that you have to do, and a special test of the echocardiography, ECG, that you have to do, right? Let's talk about the management. For the management, you have the medical management or the surgical management. In the medical management, you have a control of blood pressure, because if the blood pressure of that person is high, obviously the blood is flowing at a higher rate. So you have to control the patient blood pressure. Then is the smoking cessation. See, we have read so many topics in our CVS, and everywhere the smoking cessation has always saved the patient's life. So please guys, I'm requesting you all, please don't consume a lot of nicotine, right? And on a daily basis. Don't be a chronic smoker. Second you have is the surgical. In the surgical, you have the open repair or the EVAR. Okay, see, this is the figure. You have this. What happens is, there is a graft. This was the plaque. Okay, so this, are you able to see? This is a graft that we are tracing. So all the plaque will get side, and this basically creates a passage. This basically creates some space. Like in your house, you have only one storeroom, and you try to accumulate each and everything in that storeroom. Now what I do? I just made a small portion in your storeroom only, but a small portion of some cupboards and all the things, right? So now you will be more organized, although you are having the same amount of things in your storeroom, but now you are more organized, right? So same the EVAR repair does. Now we are done with this chapter. Let me just give you some mnemonic. The mnemonic are, what are the causes of aneurysm? So in aneurysm, remember a fat man. Not me. Remember a fat man. Okay. So A is for atherosclerosis. F is for any family history. Then A is for arthritis. Then T is for the trauma. And M is for the mycotic or infections. Right. So this was all about the aneurysm. We are good to go. Now I'll just give you one MCQ to solve and we are done with this chapter. This chapter will be asked as a short note in your exams. What is the question you have? The question that you have is, there is a true aneurysm is characterized by, okay, they are asking basically what the true aneurysm is characterized by. Involvement of only intima? No, I have read that true people are true even in your face and even behind your face. So is it the right answer? No, it involves all the three layers. Rupture of vessel wall with hematoma contained by the tissue? No, I think I have read this statement about the false aneurysm. Dilation due to spasm of vascular smooth muscles? No. C. Involvement of all three layers? Yes. This is the answer. And even if you are not able to remember now, remember 3. T starts with T and T. True aneurysm has all the involvement of 3 layers. So this was all about this chapter. If you are having any sort of doubt, you are free to DM me. You are free to ask me. Okay. Thank you so much. I hope you enjoy this lecture.